Thank you. So good afternoon. I am Deborah Barini, the president of Penn State Health Milton S. Hershey Medical Center. On behalf of Steve Massini, our president and CEO of Penn State Health, who unfortunately could not join us today due to a family emergency, I'd like to thank you all for being here today and joining us. Steve asked that I share his sincere appreciation for your leadership and support, Governor Wolf and Dr. Levine. On behalf of all of our physicians and staff within the Penn State Health system, thank you for making Pennsylvania recognized as a leader within the nation for its excellent response to COVID-19. In partnership with the Department of Health Services, the Penn State Health Milton S. Hershey Medical Center and Penn State College of Medicine are continuing to work with long-term care facilities and nursing homes in our region to adequately prepare and support these facilities when responding to COVID-19. We want to thank the Governor and the Pennsylvania General Assembly for their recent support in establishing a regional health collaborative to further assist these facilities, their staff, and residents. This pandemic has highlighted the importance of collaboration and partnerships to keep our community and the entire state safe. These partnerships with the Governor's Office, the Department of Health, and Dr. Levine and her team, with our university colleagues, our local communities and businesses, have all proven to be essential in fulfilling our mission. That mission is as simple and straightforward today as it was when we began our emergency response. Make sure our patients are safe and receive outstanding care, support our faculty and staff and keep them safe and healthy, and in doing both, we're engendering the trust and confidence of our community that Penn State Health is here for them. As early as January, our special pathogens team at the Medical Center was focused on mitigating COVID-19 risks, preparing for care of patients and adapting our policies and operations to ensure that we were ready. It was a Herculean collective and collaborative effort. From our environmental health services team, our respiratory therapists, doctors, nurses, food service, schedulers, all of our staff have had an extraordinary response that have showcased not only what they can do in a crisis, but the professionalism, creativity, expertise, all of which make Penn State Health an outstanding place to receive care. Today, our work continues, not only to ensure we can treat our current COVID-19 positive patients and that we're ready for any further surge, but also to make sure that every patient who needs care can safely and confidently receive that care with us. I know the same is true for our community hospital in Reading, St. Joseph's Medical Center, and our many clinics throughout South Central Pennsylvania. After 4 months of restrictions, we have successfully and safely resumed routine clinic appointments, vital health care screenings, all of our surgeries, and many other clinical activities. We've been able to adapt and continue our service to patients because of our tremendous staff. Some are here with us today and have been serving and working very long hours in our hospital and in our clinics, working long hours from home, and even sometimes being reassigned to new units or duties that are now part of our normal operations to keep everyone safe and to serve our community. Using guidelines set forth by the Pennsylvania Department of Health, American Hospital Association, professional societies, and the CDC, we have steadily progressed forward. Their respective guidance has aided us in our effort in effectively managing the unique situations that were presented to us each day. They've helped make available intensive care beds, ventilators, testing supplies, medical supplies, and ensured that we had the personal protective equipment that will support us today and in any future COVID-19 surge. On March 9th, at a community forum with local officials throughout central Pennsylvania, I promised that our patients and our community would get our best response to the global pandemic. Today, I continue that promise in every aspect of our care. Like you, Governor Wolf, we care about the health of Pennsylvania residents, and though the last several months have been challenging, I'm incredibly proud of our team and the response to this pandemic, and continue to remain focused on providing exceptional care to our patients while ensuring the safety and well-being of our physicians and staff. Thank you for being our partners, and know that we look forward to working with you as we move full steam ahead. Governor Wolf, thank you. Thanks.
Let me just take this off for a brief moment here. But Deb, thank you very much for that introduction and for the overview of what you did. It's hard for me to believe that about a year ago, how many are here on the nursing staff? So I was here about a year ago, and I said thank you for the hard work that you do every day. But I didn't know, none of us knew at that point what you were going to be facing, what we were all going to be facing just a few months later. And now you have come through a real onerous, tough period of time. You've been asked not only to continue the high standards of care that Deb talked about that you give patients here, but you also had to make sure that you kept yourselves safe and each other. And what an amazing challenge that you faced. You were on the front lines of this real struggle, and I said thank you then, and the thank you I'm saying today is even more heartfelt. All of us really, really appreciate the work that you did to keep us safe through this pandemic. Pennsylvania has done pretty well so far. I mean, I'm knocking on wood here. Pretty well so far. I think we've had good policies. And I think with Dr. Rachel Levine, who is also still on the faculty here at Hershey, and was vice chair of pediatrics, that we've gotten really good policy leadership. But what we really had was people like you on the front lines who made sure that our patients were well cared for, and that you kept each other safe. So I just want to say thank you again for what you did to keep Pennsylvania safe through this really, really tough time that we've gone through. So thank you very much. And that's really what I'm here for. I wanted to just come back and showcase the work, the hard work, and the centrality of these frontline workers to what has happened in Pennsylvania. And not to brag, well, I'll brag a little bit about what we've done. I think the CDC recently said that there were 3 states in the United States that had, this is a couple of weeks ago, 42 straight days, and we use a 7-day moving average, but 42 straight days of decline in COVID-19 cases, and Pennsylvania was one of those. Since that time, I think 2 of those states have actually been kicked off that list, so we're the only one left standing. We've actually, and you have to use a 7-day moving average, not because we're playing games with statistics here, but because over the weekend you have less reporting, and so on Mondays usually you have a surge in numbers. But we have been consistently on a downward track, and that has continued. Again, I think it's because we have good policy guidance from the Department of Health, Rachel Levine, and she's done a phenomenal job, but also because of what you have done and your colleagues have done throughout Pennsylvania on the front lines. If you just think about it, the special pathogens team, all the different teams that have come together to work here, the cleaning crews who have kept these facilities clean and sterile as you've gone through this, the scheduling, human resource, to the medical professionals who care directly in one way or another for the patients, and everybody else who's played even the smallest role in the operations here. All of you have been on the front lines, and all of you are responsible for that statistic that I talked about. I mean, you have done phenomenal work that just isn't happening in other places, in other states. Right now, we're in the eye of this pandemic. It's possible, and maybe it's even likely, that in the fall we're going to have a resurgence. But right now we have a little bit of a breather in most places. There's some little outbreaks here and there throughout Pennsylvania. But we're going to get back into full active duty on this pathogen, this particular pandemic, when we get back into the fall. And right now we're doing everything we can to prepare for that. And that includes continuing programs that allows us to get back to normal. We bought time in March, April, and May to make sure that our healthcare system throughout Pennsylvania was not overwhelmed, and we succeeded in that. We now have things that we didn't have back then. The most recent data is our daily testing rate is now up to 16,000 tests a day. I think we were in the hundreds when we first started. So we've come a long way there. We now can do contact tracing in ways that we couldn't do before. You all know more about this disease than we knew 3 months ago. So all those things make what we're going to face, whatever it is in the fall, I think we can face with a lot more confidence and do things a lot differently than we did in the March, April, May, and parts of June period. But the things that will help and that we now know made a difference back then will continue to make a difference. And so I want to I know Dr. Levine is going to say the same thing. We have got to make sure that we do everything we can to reduce the risk that this disease is going to get us. We've got to keep wearing masks. We've got to keep practicing social distancing, wash our hands. If you feel not well, you asked me the questions when I got here, not just taking my temperature, but asking me if I'm not feeling well, don't go to work. Stay home. All those things make a difference. And I think all those things, in addition to the testing, the contact tracing that we're doing, the practicing social distancing, all those things are going to help us do a better job of facing this pandemic when, as we expect, it reemerges in the fall. But in the meantime, I just want to say thank you to all the healthcare professionals. Everything that you did here, everything I said back a year ago was true then, but it's even more true now, given what we all faced here. So thank you for giving me the ability to say this thank you and show my gratitude to everybody here. And now it's my great pleasure and honor to turn this over to the real hero of the Commonwealth of Pennsylvania's response to the COVID-19 pandemic, and that is Dr. Rachel Levine, our Secretary of Health, again, still on the faculty here at Hershey Medical Center, and she's done a phenomenal job leading Pennsylvania through this effort. So, Dr. Levine.
Well, good afternoon. Thank you so much, Governor, for that wonderful introduction. I appreciate it so much. And it is wonderful to be back at Penn State Health, the Milton S. Hershey Medical Center, and the Penn State College of Medicine, where I spent many years. And it's true, I am still on the faculty at the Penn State College of Medicine. But mostly, I would like to thank the staff at Penn State Health and all of the nurses, the doctors, the EMTs, the first responders, and all of the staff who bravely answered the call to help. Your efforts have saved lives under the most difficult, extraordinary circumstances. We are forever grateful for your service. The Governor and I have called on the community throughout this effort to do our part to protect you and to protect each other. And a big part of that is wearing a mask when you go out in public. And the studies are very clear about the effectiveness for the community if everyone is wearing masks when they're in public. By wearing a mask, we are not just protecting ourselves and others to exposure to COVID-19, but we're actually really saying thank you, to the brave healthcare professionals who are working every night and day to literally save our lives. Another way that we can say thank you to our healthcare professionals is to get tested for COVID-19. As the governor said, and we were just screened, if you're feeling ill, please stay home and don't go to work, but get tested. We have hundreds and hundreds of testing facilities available throughout Pennsylvania at hospitals and academic institutions, but also at many areas, including many CVS, Rite Aid, Walmart, etc. We have partnered with major retailers like Rite Aid, CVS, and Walmart to ensure that anyone who wants a test can get one. I have also ordered all skilled nursing facilities, all nursing homes in the Commonwealth, to test every resident for COVID-19 and every staff member for COVID-19, and we will need to continue that type of testing. Today, we are actually announcing a new partnership with CVS Health to assist with the nursing home testing. This partnership strengthens and increases access to ensure that universal testing of these facilities is completed as required. CVS will administer up to 50,000 tests for skilled nursing residents and staff members beginning this week, the week of June 29th. As we all adapt to really always being prepared, please also remember to stay calm, stay alert, and stay safe. Thank you very much. And now it is my pleasure to introduce Dr. Cynthia Whitener, an infectious disease and head of the infectious disease programs here to prevent COVID-19. We were discussing that we've known each other for more years than we will either admit. But thank you very much, Dr. Whitener.
I have to get my 20 seconds in here. So good afternoon. As Dr. Levine said, thank you very much for that wonderful introduction, and I will not give away the years either. I'm Dr. Cindy Whitener. I'm the chief of the Division of Infectious Diseases here and the hospital epidemiologist at Hershey Medical Center. And as Deborah mentioned as well, it has been quite a busy first half of the year for all of us here. Over the last few months, though, it's been very gratifying to see so many members of our faculty and staff dedicate themselves to preparing our facility and caring for so many COVID-19 patients. Developing plans and protocols for patients has been a genuine collaborative effort by many, many people. We have worked with teams from specialties across the health system, including emergency medicine, infectious diseases, internists, hospitalists, intensive care physicians, surgeons, nurses, respiratory therapists, ethicists, environmental health, and that's just to name a few. Everyone came together to develop our best practices, to provide safe, high-quality patient care. One of the things in particular that's very exciting for us is the ability to offer our patients cutting-edge therapies, such as through our participation in a multi-center remdesivir clinical trial. Outside of this clinical trial, we have been able to treat additional patients with this medication in partnership with the Department of Health through their allocation of remdesivir for clinical use. We're also able to offer patients other possible beneficial treatments, such as convalescent plasma, as part of an expanded access program. We are very pleased that here in central Pennsylvania, we can provide excellent supportive care in addition to innovative options, and also contribute to vital worldwide COVID research. We're fortunate to have another distinct asset at Penn State College of Medicine, our medical students. Despite their way of learning changing significantly during the COVID pandemic, They were very eager to step up to actively participate and help our patients. Hundreds of them joined task forces to assist with a variety of efforts, including contact tracing, identifying and reaching out to potential plasma donors, and working with local personal and long-term care homes to help mitigate the spread of COVID-19. We have learned a lot over the last few months about how to best care for our patients, and we have recognized that our census of hospitalized patients with COVID reflect the epidemiology of the virus in our surrounding communities. Going forward, it seems clear that all of us must remain vigilant in order to achieve a long-standing decrease in viral transmission while waiting for an effective vaccine. Yet, should the communities we serve experience a resurgence of COVID-19 cases, we believe our adaptable hospital surge plan enables us to continue to care for COVID patients while maintaining a safe place to care for all of Penn State Health's patients. I want to thank Governor Wolf and Secretary Levine for their ongoing efforts to guide the Commonwealth through this pandemic, and for their diligent reminders about how each and every one of us can reduce our chances of getting infected and spreading the virus to others. Wear your mask, practice social distancing, and wash your hands. Those are the three key messages, especially wash your hands. I now want to introduce Allison Enimpa. She is really one of the key nurse members on our special pathogens team. She's been with us since the beginning, I believe in 2014, and she's been working in our COVID units.
Good afternoon, everyone. Thank you. Thank you, Governor Wolf and Dr. Levine, for being here today with us as we celebrate the nursing staff and all they've done here for Hershey Medical Center and for our health system. The Special Pathogens team over the last couple of weeks and months has done extraordinary work, and I'm so terribly proud of all of them. But the work did not begin in January or February or March. It actually began 5 years ago in response to a different special pathogen, Ebola. And as that threat tapered down, our work here did not end. We continued for all of these years, every 3 months, meeting in the same center in small groups, practicing and watching each other don and doff our PPE, making sure that we were doing it correctly for the safety of each other, looking and re-looking at policies and procedures, participating in tabletop drills and full-scale exercises. And really that has led us to be ready even today. And so when we knew that our COVID-19 patients were coming to Hershey Medical Center, we were able to take that group and mobilize them very quickly in a safe and efficient manner. And the dynamics of that group was so that it was emergency room nurses and oncology nurses and peri-anesthesia nurses and SICU nurses all coming together with respiratory therapists and providers and environmental health and dietary. All sorts of multidisciplinary teams truly all coming together, knowing that we had to take care of this COVID population. And so our task was, truly, we were going to have to make it happen. And I'm very proud to say that I think we did in a very fluid and dynamic way. We had heightened awareness of what it was that we needed to do to keep each other safe, to keep our patients safe, and to keep moving forward. We were adapting and adopting new things, as Dr. Barini said earlier, even changing how we communicated with each other. You know, our RN communication is now behind 2 shields and a glass door. And I remember saying to another nurse, as she asked me to pass her a medication, I thought she was asking for a muffin. And clearly that wasn't it, but it just goes to show about, how we were communicating with providers and immersing ourselves in the environment and understanding what medications and treatments needed to happen in order for the care to go on. and having them ask us what it was that they needed to be done when they walked into the room in order to minimize our personal risk. And the teamwork is really indescribable. Having all of those people from different units all across this organization come together in such a way that one could not have predicted to work out so well, in a way that we never learned how necessarily before this year. My most precious memory of this entire time so far has been the discharge of a patient that had had a stroke, and she was unable to articulate more than a few words at a time. And in full PPE, we were getting ready to put her in the wheelchair, and she hugged me. And I hugged her. And even though it's not something that is recommended, it felt right. And we knew it's a reminder that it's such meaningful work for everybody involved. So I just want to reiterate that the skill and the courage of all of the staff members, the nurses, the respiratory therapists, all of our team members, our providers, we're very proud of the work that we've done to take care of ourselves, to take care of our patients, and we've done so with purpose and with passion. And moving forward, I'm hopeful that we have prepared ourselves and our organization and our health system and our state and our country to move forward safely and with compassion. Thank you. And I'll welcome Governor Wolf back to the podium.
So I would be happy to take questions and pass them on to the experts here if there's something I can't answer. Anybody have a question?
Governor Wolf,
Yes.
you summarized a lot of things that have happened since February and March that
Right.
put us in a better position to deal with the resurgence that you're predicting for the fall. But do you think there's any chance we would have to go back to the more draconian steps such as closing schools? How much of a chance do you think there is that it would get so bad that you would need to do that? And is it even possible to do those things again?
Yeah, I mean, that's a great question. I'm not a fortune teller. I don't know what the future is going to hold. So, I mean, who knows? But I can tell you that we are doing everything we can to avoid that happening. And I think we are in a much better place now, as I said, with capacity in the healthcare system, with the expanded ability to test. And then again, we went from hundreds to tens, over 10,000, 16,000 as of yesterday per day to be able to test. We are working hard to build up, what'd you say today, hundreds of people do contact tracing. We're over on the way to 600, I guess, right? Contact tracers. So all those things. We know more about things like masks, social distancing, things that actually can work. And businesses, as they open, are doing responsible things to make sure that their customers, their employees are safe. All those things taken together, I think, mean that when we get to the potential for a resurgence in the fall, we're going to be in a much different and better position than we were back in March, when we really just had to buy time and we had very little to work with. Yes.
Going off what you said, Governor, about how you would be able to face a resurgence with confidence in the fall, but also do some things differently, what would you do differently if there is a resurgence?
Well, as I just mentioned, I think what we can do differently is take advantage of the resources we have now that we didn't have. For example, we couldn't test back when this whole thing started. Now we can. We don't have enough to do surveillance testing, but we have at 16,000 tests a day. I think that's more than we could do in March, probably. So we do that in one day now. We had about 100 public health nurses around the Commonwealth. We now are on the way to 600 people who can do contact tracing. So there are things that we can do now that we couldn't do. We have better information. We know more about the importance of wearing masks. No one thought about that back in March. About social distancing. When you go into a restaurant, how do you behave differently? And really, a lot of this rests on how we take precautions. We've learned to do that throughout our lives, stopping at stop signs, to doing everything in a whole lot of different ways to avoid or to reduce risk. You never eliminate it completely. We've learned things, each of us, all 13 million Pennsylvanians, how to reduce the risk of getting this disease. All those things are going to put us in a much better place if we have a resurgence in the fall than we had the things that we could do back in early March. Yeah.
Governor, come Friday, Lebanon County will be the only county remaining in the yellow. You have been asked whether you can change that. How do you stand on that?
Actually, I think Philadelphia County is also in the yellow. We're working on that. Again, and Dr. Levine, maybe you want to take a look, a stab at this, but we're doing everything we can to look at what's happening with case counts, what's happening with the capacity of the system, and so I think Dr. Levine is working closely with the folks in Lebanon County to make sure that when Lebanon County moves to green, that they're ready to do that. So, do you want to say something?
Sure. Thank you, Governor. Philadelphia County, from our perspective, could go into the green. I know that they are going to hold off on officially going into Dr. Farley, the health commissioner's version of green, until the week after. But from our perspective, their metrics were they could go green. But you're correct. Lebanon County last week had significant increases in terms of their incidence of COVID-19, and did not meet the metrics to go forward. We have spent the weekend doing a deep dive in terms of all the details in terms of the cases in Lebanon County. It is, like most counties, a combination of community spread and in terms of nursing homes and other long-term care living facilities. Remember, it's critically important that the nursing homes and the long-term care living facilities essentially reflect the prevalence of the county, because it is the asymptomatic or pre-symptomatic staff that are the only ones entering the facilities who, unfortunately, without them knowing it, are able to carry it in. And that's the key to our universal testing, so we can test everybody whether they're symptomatic or not. We have developed a plan in terms of increasing testing in Lebanon County, and in terms of enhancing our contact tracing directed towards Lebanon County. We spoke with the county commissioners and a number of public officials yesterday. We outlined our plan. We're implementing our plan, and so we'll be watching the data really closely. And when the numbers have shown that those cases the numbers of new cases are decreasing, then they'll be able to go to green, and we'll continue to monitor them very closely. Yes.
Dr. Levine, we're still hearing from some residents and loved ones who are frustrated, scared, and desperate to improve the situation inside some nursing homes. Mm-hmm. At places hard hit such as Brighton and Beaver County, residents are reporting that not much has changed or gotten better more than a month after a new manager took over. They wish the National Guard was still there and had stayed longer than a week. Local leaders as well as loved ones are reporting a lack of communication, getting hung up on when they try to call for updates. What is the Department of Health doing now, in addition to the testing support that you announced? What is the Department of Health doing now and in the coming weeks and months just to make sure that to prevent the further spread of COVID cases and deaths in nursing homes, and to hold the owners and operators accountable for doing what they should be doing?
Absolutely. So it brings up a very important point, which we like to emphasize, is that we regulate the nursing homes. The Department of Human Services regulates the personal care homes. We inspect them either virtually or in person with PPE when necessary. We provide personal protective equipment to these facilities. We have had well over 2,000 dispensing implementation events where we have dispensed PPE to the facilities. We provide infection control advice either virtually or, if necessary, even in person to the facilities. And we can send in the National Guard if we have staffing issues, but we don't run the facilities. But we are keeping in contact with any facility on a regular basis that has cases of COVID-19. It is the responsibility of the facility to keep the loved ones up to date in terms of their the patients and their status in the facility. But we do have on our website, which is updated now once a week, the information from the facility that they provide to us, which we then put on our website. We have a few some facilities that still aren't reporting correctly, but we're going to work with them individually to fix that. And so we continue to have regular contact with all of the facilities. We will continue to do that. And as you mentioned, the testing is critical because it is, since at the present time, no visitors have entered the facilities. It is asymptomatic or pre-symptomatic staff that have unknowingly, brought the disease into the facilities, and then it can spread in the facility. So we're going to test all the staff, we're going to test all the patients, and we're going to continue to do that on a regular basis. We will be doing it on an individual basis to the facilities. We'll come up with a testing plan with them, depending upon the location and how many cases that they have. And we will continue to provide absolutely everything we can to support our most vulnerable citizens in those facilities.
What do you say to the loved ones who are getting hung up on when they try to call for updates? Are those the kind of things they should be reporting to you guys? Or?
Yes, we have anonymous reporting, so they can call us if they have any complaint about any facility. They can do it and tell us their name, or they can do it completely anonymously, and then we will investigate. And we continue to investigate any facilities that we have complaints in. We might do it virtually, or if necessary, our staff are trained to gown and put on the masks and go into the facilities to see what's up. So we'll continue to do that.
Is there any increase in staffing to do so, and inspections and stuff on DOH side?
Yes, we are working to. We're always working to hire more nurses and more inspection staff. It's hard to do, especially in the current times. But yes, we will continue to expand our staff at QA to be able to do that. We have infectious disease consultations with ECRI, our consultants, and again, when there are critical staffing needs, the National Guard will go to the facilities, and we have a new contractor to have other individuals at the National Guard are already seeing other facilities. We have contracted with a new vendor to go into the facilities as well.
Last one, does that concern you that they're saying they wish the Guard was still there, that it got better when the Guard was there, but then it got worse again when they left?
Any concerns about those facilities from their loved ones concern me. And so if they have those concerns, please contact. It's easy to either call or go online to tell us that information, and we will investigate.
A question for you, Dr.
Sure.
Levine. In a nursing home, if all residents and staff continue to test negative, does the Department of Health have any guidance on visitations with families in person, whether it just be outside, to have that person-to-person contact?
That guidance we put out later this week. So today's Wednesday. So I'm hoping by Friday. I guess it could drift to Monday, but our goal is that at the end of the week we're going to be putting out guidance about visitations at the skilled nursing facilities that we regulate. It is a very important point, and you can understand the nuances, because as we allow visitors, we want to do that in the most safe way, so we don't run the risk of bringing in, again, asymptomatic individuals to those facilities. But we're working on that guidance. We understand its importance, and I'm hoping it'll be out Friday. I guess it could be Monday.
Dr. Levine, I'm sure you're tired of talking about this, but there seems to be a growing number of people that are really pushing back against the mask. I think Governor Wolf even talked about this yesterday. Representative Metcalf is pushing against legislation to wear it in the Capitol. And so it just seems like kind of all of us have gotten tired, but are really pushing back against the mask. Can you hit one more time why these are so important?
So I want to emphasize, this is not a political issue. This is not a partisan issue. This is a public health issue. There have been study after study which has shown now that these very simple cloth masks, they're not foolproof, but if I am wearing a mask and I am one of those asymptomatic or pre-symptomatic people with COVID-19, then I have a significantly less chance of having those droplets go out to people near me. And if you're wearing a mask, it's the same. And if the whole community is wearing masks, if everyone in a store is wearing masks, if everyone even outside are wearing masks, then we are protecting our community, we're protecting our loved ones, we're protecting our family, and in the end, we're protecting our Commonwealth from the spread of this very dangerous virus. And I know people are tired of COVID-19. It has been extremely challenging last 4 months or more for everyone in Pennsylvania. But we are not done with COVID-19. COVID-19 is not gone. Through the policies that the governor has implemented, which were very challenging, but the mitigation policies, the closure of schools for the school year, the closure of non-essential businesses and the stay-at-home orders, we have bought time, and we not only bent the curve, we flattened the curve, and it has gone down in terms of the number of new cases. But COVID-19 is not gone, and you can see that when you see the concerns that many states are having, such as Arizona, Texas, and Florida. And so we have to be alert, and we have to stay vigilant, and we have to take precautions that protect all of us. And one of the most important precautions is to wear a mask. The other is to stay social distance at least 6 feet away, and the other is to wash our hands and use hand sanitizer. They might seem very simple. I have repeated it on probably every single news conference that I've given now for 4 or 5 months. But I'm not tired of saying it because it is so important. This is not a political issue. It's a public health issue to keep us safe.
Thank you.
Yes, Governor.
It's sort of like stop signs again. I keep bringing this up, but it's not a liberal or a conservative thing. So, I mean, imagine if we had a society where only liberals stopped at stop signs or conservatives. What sense does that make? I mean, you don't stop at a stop. You go through an intersection and you raise the risk that you're going to be hurt. Doesn't matter what your party is or what your ideology is. I think it's the same thing here. I don't know how this became political, but it is. But you know, all 13 million Pennsylvanians, we need to internalize this, and we need to figure this is what we've got to do. This is the new normal. And, you know, we live our lives trying to reduce the risk of all kinds of things. It's just one more thing we now have to do because we have an infectious disease that's lurking out there. That's the enemy. It's not me. It's not Dr. Levine. It's not Donald Trump. It's that virus, and that virus is out to get us. Anything we can do to reduce the risk of that virus, I think that's something, and it's not a political thing. Any other questions? Yeah, go ahead.
What attitude should people have in regards to COVID-19? I went to Saturday nights in the city in Harrisburg, and I saw crowds of people gathered together. Some people had on masks, some people didn't. And it seemed like in March there was a heightened sense of the contagiousness of this disease, and people had on masks. They were going into Walmart, wiping down carts, on hand sanitizer, and it seems like that has fallen off with the reopening of the Commonwealth. What attitude should people have right now in relation to coronavirus?
Well, it's the same thing. I think Dr. Levine and I were just saying it's not a political thing, and in March, the coronavirus was an infectious disease that was very contagious. We're now in June. It's still a very contagious, infectious disease, and so I think you're right that some people, the weather's nicer, you can be outside more, and that's one of the things social distancing does mitigate the likelihood of the disease. But I don't. This is one thing that I don't think I want to play roulette with. I just as soon say let me do what I need to do to stay safe. If I'm going to take a risk. I mean, I went out and took part in a protest demonstration in Harrisburg. I took a risk, but I knew I was taking a risk. It wasn't like I'm just ignoring the fact that I'm taking that risk. I'm increasing the possibility that I'm going to get this disease. I knew that. I took that risk. You're going to do that in life. You're going to go through an intersection for some reason or another, and likely you'll make it through, but you might not. And why would you take that added risk for no reason at all, just because you don't believe it? I think we need to redouble our efforts if we're going to continue to succeed as Pennsylvania. It's not going to be because Dr. Levine and I have great policies. It's going to be because every one of the 13 million Pennsylvanians, Republicans, Democrats, men, women, everybody, sits down and decides in their lives they're going to do what they need to do to reduce the risk of getting this disease. So I think you're right. There seems to be a little bit of a relaxation here. I think we've somehow nationally made this a political issue, and I'm not sure why that is. The reality is that virus is still out to get us. That has not changed, and we need to do everything we can to reduce the risk that virus is in fact going to get us. Dr. Levine, is that pretty much all right? Thanks. Okay, thank you, everybody. Appreciate it.